Weeks after Governor Rick Scott signed legislation limiting the number of opioid prescriptions in the state, Congressman Vern Buchanan is taking action at the federal level. ABC 7's Erica Jackson joins us live from Centerstone in Bradenton with details about the new legislative plan. Erica?
Good afternoon, Scott. Congressman Vern Buchanan is calling it the Opioid Emergency Response Act. It's a combination of seven different bills focusing on access to treatment and better screening to catch these drugs before they make their way into the United States. If passed, the $3.5 billion bill will increase the number of mental health providers in the state by about 66%. It will reduce opioid use among Medicare patients and instead recommend using alternative painkillers like Tylenol and Advil. And it will stop drugs like fentanyl and carfentanil from making its way into the country by requiring more intense screening by the U.S. Postal Service. Buchanan says drug overdoses are the leading cause of death for Americans under the age of 50.
Out of our thoughts, and it's going to get the kind of resources that we need. Everybody says we're not putting enough resources in it compared to the challenge and the problem that it is. This is about $3.5 billion. I think it's very substantial. We've done some funding in the past, but we need to go to this level to get it done.
And at the end of 2017, President Donald Trump declared the opioid crisis a public health emergency. And at the beginning of this year so far, the number of suspected overdose calls has decreased drastically locally, for 80% in Sarasota County so far in the first few months of this year, and 75% so far in Manatee County compared to this time in 2017. We'll have more tonight coming up at 5. Reporting live in Bradenton, Erica Jackson, ABC 7, your Suncoast News.